You don't look at it as a negative. I would assume you have to look at that as a positive because, as you said, 2 hours later. So 2 hours at least, the kid deserves some credit.
Right. Yeah.
So you work with that, I'm sure.
Yeah, we do. And I guess more for me, it's not that it's a negative, but then I take it as a negative for me because I feel like I've dropped the ball that day, that I should have been. And then I have to stop and think, okay, no. And it's usually one of my wonderful friends on Facebook or something. I have girlfriends, and they'll say, like, what are you thinking of? You've got 6 people that you're looking after. And, my in-laws live down the road. My mom lives across the street. We've got my dad here at Country Meadows. And it's more, if it does turn to a negative, sadly, I've turned it to a negative to me because, like I said, I've dropped the ball, and I'm like, oh.
That's an inward feeling.
It is.
But the outward expression has to still retain the smile.
Yeah, yeah.
But let's talk about, the members of the family, or when you've heard from other people that are in similar scenarios as you. We still recognize that where we've come from, and that's the relative of importance here, I'm sure. You've come from ground zero. Yeah. So if you've gone up to, let's say, the scale between 1 and 100, and you happen to be at 65, and you have a letdown to go back to 64 and a half, that's not a bad day.
No, no.
0 was a bad day.
Exactly. Yeah, we always hold it back into. Yeah, well, that's what we say. It has been worse.
Yeah.
But at the same time, we know we can get it up to an 80, or we can get it up to a. So then let's just.
But in time.
Right. Let's just keep going, and that's what we have, and that's what we try very hard to do, because we do have setbacks, and for us. With Sam, it seems to be about every 6 months we get, I call it being blindfolded with oven mitts on. Yeah. And we seem to get, and I always tell the doctors, I'm not trying to be facetious or be a smart aleck, but I get that 2x4 kind of right up the back of the head, that, where I get a momentary brain injury because, this is what I've been asking you, and keep
I think
smiling
too,
and keep going.
I think too, your aggression here is relative because it's family.
Yeah.
and you want to see, and I understand where you're coming from. I can't say I've been there, done that, but I can, as you paralleled it to cancer, I can parallel it to other things too. And you want, there's no question, you want what's best for your family. Yeah. And in order to gain that, you're feeling sometimes perhaps I got to work a little harder without recognizing that we're okay, but we're dealing with somebody in trauma.
Right, yeah.
So do you have to bring yourself down a stair or two?
Sometimes I have, yes. Other times it has been more because, and this is because I have been told by many professionals, and just in the last couple months, that they really wish that they had been taught while they were in school to listen to family members.
Right.
Family members know what's going on. And when I'm in a doctor's office in Winnipeg, because they have, this is just his job. He doesn't go into the hospital and do emergencies. No. Your job is in this little office that is 12 by 12. Your job is to listen to me. I'm telling you what's been going on for the last 6 months. And I understand that you have, 40 or 50 other patients, but when they're in here, I expect you to be giving him or those parents their full attention. Just like when my kids talk to me, and everybody's human, but when it comes to brain injuries, because there is so little education, even for the doctors, because like I said, Sam has 3 fragments of the bullet in his head.
Right.
Somebody could have that exact same trauma, and it could follow the same patterns, but their outcome is going to be totally different. Yes. Because they do deal with different people. So when you are dealing with instances where everybody is different, there's no prescription that says, okay, now you're going to get sick, you're going to do this, you're going to do this, you're going to do this. Right. But you know what? You could have seizures in the next little while. And just because 2.5 years, which is what happens to us, just because 2.5 years have gone by and you've never had a seizure,
doesn't mean it's not going to happen.
Don't let your guard down.
Right.
Sure enough.
Yeah.
Not that I let my guard down, but I was making other future plans, and then we woke up and Sam was seizuring. Yeah. And then when I came back and I said, but I told you about this, and this that's all been happening. Oh, yeah, well, that's normal seizure activity. Yeah. I've been telling you this for 2.5 years. Yeah. So then it's like, okay, so what else have I been telling you that you're dropping the ball on? Or maybe not, but just waiting until it gets building to a point.
But I think, too, in fairness to both sides, both the professional side and the caregiver side, and we've touched on it a little bit, This is one of the avenues in the areas where the education factor for both, we're very limited, aren't we?
Yeah.
It's not like where we can draw the parallel. It's not like pregnancy.
Yeah.
It's not like giving birth. That's been going on for centuries.
Yeah.
But brain injury has been something of a relative with only in the last X number of years. It's not as though we've been dealing with it for a long period of time.
No, and that's where we're coming from, or I'm coming from, is, 5, 10, 15, 50 years ago, it was always, oh, that dumb jock. And it's like, okay, but he's not a dumb jock.
No.
He's somebody who's had a concussion maybe 2 or 3
Right.
times,
Yeah.
and nobody has recognized it.
Right.
And that's like with Dennis, it was in the 90s, and brain injury wasn't a big thing. And unless you lost consciousness, or you had bleeding in your head, or swelling in your brain, or
Right.
nobody looked into anything. And even
No.
then, there wasn't a whole lot done. And so when I started reading, and I discussed this with our doctor, and he said, you know what, I think you're right. So Dennis, we call him the undiagnosed brain injury.
Yeah.
But when I talk about things and we give him tools to work with, and he like he says, he uses them and they work.
Yeah.
So, there's you
utilize the tools you're given.
You do, yeah.
Yeah.
And it's just, like I said, people are so scared to say, well, I have a brain injury.
But you touched on something here too, which I have a lot of respect for. When you said you spoke to somebody in the profession, and they said, I don't have a lot of knowledge on that, and I respect that, and I think you would too under the circumstances, rather than have that person misdiagnose.
Yes.
And at least more so in this day and age than what we were doing 20 years ago. We're referring people a lot faster today than what we were years ago. You also touched on something that you and I talked about in my trying to coax you to come on air and talk about this. And we talked about the relative frequency of we're hearing about hockey fights.
Yes.
And guys getting hit in the head, but also from body checking, high body checking, where elbows and arms hit the head, and guys are going down at a relatively fast clip. The last 2 people who have passed away within the NHL, Probert and Bogart from the New York Rangers, families have both donated brains to science.
Yeah.
I would imagine, from your perspective, that is a traumatic step forward.
Oh, huge. And at the same time, you're like, well, you're very excited, but you want to hurry up now, give us the answers that we need. But you can't, because they need more than 2 brains, and they need more than 10 brains.
Yes.
They need like thousands of them to kind of say, like this is what. So it's I guess it's really neat seeing it from our perspective, because this is, like you said again, this is ground zero.
Yeah.
So we're going to be watching this and learning this as it goes and promoting it. Like I work with the football team and help there, and I'm telling the boys, if we on the sidelines can't diagnose concussions, but if you're feeling ill, or you're dizzy, or you're seeing double or whatever, sit down. Your brain and yourself are not worth going out and scoring a touchdown. And I know you're 15 and you really want to go out there and do that, but this is more important.
It's not worth your future.
No, it's not.
And we'll get back to we'll get back to the families that have donated. You're right. It's a start.
Yeah.
I know you said thousands, but you've got 2. That's 2 more than you had 5 years ago.
Exactly. Yeah.
So everything has to start from a point.
Somewhere. Yeah.
So let's be thankful for that. And you've also touched on a few things that football. And you talk about the banging of the heads, and you look at what's inside the hockey helmet, what's inside the football helmet. They're looking now at trying to change things.
Yeah.
One of the things that just come out the other day, and I don't know if you're familiar with it, but Hockey Canada just made an announcement yesterday and said they're going to change the rules as we know of them today with regards to people who tried to hit in the head. And they're going to start it in the junior hockey ranks and work down, both male and female. So it should have the effect, hopefully, that the punishment will suffice to meet the crime.
Yeah, and that's I think where the biggest help will be, and because sadly it's like you watch hockey and there's football parents out there too, and like I have football mom written on the back of my jacket, but I'm not one of those screaming and yelling. I mean, I do yell, but it's usually because so I can be heard over everybody else. So my voice will carry.
I can't believe you'd yell, Jodie.
Oh,
Can't
no,
believe
never,
that.
Never.
No.
But football too. We watched an article, and I've contacted CBC and CTV about it. We think it was an Alouette that was on this winter, and he was talking about getting making their helmets so that they are safer. And it's something as simple as it's like a chip that goes in the top of the helmet, so that when they get hit hard enough, it will actually send a text or an email to a cell phone or to a computer or a BlackBerry or whatever that says, you know what, this guy's been hit hard enough that he has could have acquired a brain a concussion.
Yes.
So, but we're trying to find out more information, and obviously they're going to be very expensive because they're first on the line. But you know what? The more awareness we can bring about this and how important it is, maybe the more they can get them made and maybe bring those costs and get them out there more. Because it's not just the professionals that need it. Like you said, start it smaller so that the next generation coming up in these sports are going to be knowing it.
The thought now with the NHL is that if you've been hit in the head and yet you can still get up and go to the bench, they still want you to go back into the dressing room after that hit and have a doctor look at you, which I think is a step in the right direction. They never had that before.
Yeah.
I want to go back and talk about junior hockey, and it started, I think, about 8-9 years ago, where they put a little stop sign on the back of a shirt that said stop. I mean, well, that might have worked for the first 4 games, and then after that, so you see the decal.
Yeah.
But that was important that they thought about it then.
Yeah.
But they've got more reason to be conscious of it more today. I want to go into an avenue that we really haven't brought into play here, and the more I think about it, the more it's pertinent to brain damage and trauma, and I don't know if it fits in the same light, but have you ever had people talk to you about the effect of the continuation of drug users as it affects the brain? Or alcohol, excessive drinking of alcohol, as to how it affects the brain.
Yeah, well, after a brain injury, you actually, one of the things that we've been learning is, I have it here, after one brain injury, you are 3 times at greater risk to get a second one, and 8 times greater for after a second one.
Okay.
So, obviously, one thing that we are trying to teach our kids, just because they're kids, is, you know, try to be smart if you're going to be drinking. Phone, don't drive, don't don't go binge. But especially with Sam, we say to him, you're already a little off kilter. You know, your balance can be off in that sometimes. So maybe it's best to not overindulge in the alcohol or in drugs, because you're already one step there. So, and that is, we did learn that, but it was kind of glossed over. But I think maybe it could be because for us, Sam is so much younger. And the other groups that we go to, Sam is one of the younger ones in the group. And everybody else is so much older, like older than Samuel, 35, 40, 45, 50. So they're kind of past those stages of, you know, binge drinking and whatever.
The reason I introduced that is because you brought it up earlier too, and I just want to correlate that to what you're talking about. And it's one of those things about individuals suffer brain injury due to a variety of causes, including the following, and they give about 9. And the first one on the list is automobile collision or sports/recreational injuries. So there you go. You know, we overindulge, get behind the wheel. Chances are, what's the first thing that hits the windshield? It's not your feet.
No.
You know, so.
And something, actually, I forget what it stands for, but it was party risk. And it was about these new extreme sports that are coming out. Everybody wants to be the one who does this first.
Well, there's the cage fighting. And
and that's huge. In brain injuries, like when they don't always necessarily, like when they say that it's sports and contact sports, it's not necessarily that it's a football or a hockey game. I mean, obviously those boys will get head injuries, but and girls. But when it's those extreme sports, you are just increasing your chance by that much more, because of course when they're not only are they doing the extreme football, but they're doing it with no padding, or they're not wearing neck collars, or so that's.
Well, there was a reason that they put netting up and glass higher in arenas. Because pucks were flying up and hitting people in the head. People go to ball games, and what do? Is they gossip at a ball game when they should be watching what's going on from the batter's box. And I've seen a lot of people take a bonk on the noggin, and therein lies still an opportunity for shock trauma.
Exactly.
You know.
Yeah.